uh, we expect around 50 participants in this webinar. It was a short notice. We started, mentioned it, I sent the invite like yesterday, last night, and in this short notice, 50 people could reply back. That's wonderful. Um, as I have mentioned, this webinar is going to be about the beginners, the people who have less information about medical PG in Germany. For them, this webinar is going to be dentist and medical, like doctors. If you have specific questions and all, definitely I will answer them by the end of this webinar. So time. Now this, what you have in your screen is the list of documents. Okay. Now list of documents, we will first go through the list of documents so that guys who are in the beginning phase, they first need to know what is required. If they have that, don't have that, how can they get that? That is important. And once we have discussed about list of documents, then we'll go through the process little bit, that how it has to be, and then we will see further from that. Okay, this is going to be a 60 minutes webinar. We are going to take questions at the end, so we have already 2 minutes finished. Let's go further. Required documents. Now, following documents that, I mean, this letter, this document is prepared by Dominus International. So we have taken for all the states that are there, the average or the most of the documents are required over there. We have taken that. So far, we have not come across any Bundesland, any state which requires more documents than these. So, but a little bit discrepancy can be here and there. But this is the basic. This is the documents that our candidates who are in our consulting program, they submit to us. Okay, so submitted per post. The application always goes through post. Nowadays, many states have also started online application, but that does not replace the per post application. That means you have to fill the form online and print everything out, sign it, and then again send it per post. So that is two-step, then online and offline, not just offline. It used to be initially. Okay, so a CV has to be prepared in German, a tabular and chronological CV, and it has to be signed at the end. That is, in most of the countries, signing the CV is not very like important. CVs are not supposed to be signed, but in Germany, the CV has to be signed. That's important. And the application form for Berufserlaubnis and approbation. Now, I will not go into the, I mean, this you will find on the website. Now, important thing to know is that what is Berufserlaubnis and what is approbation. So, as I said, for the beginners who are watching or new to this system, when we go through these documents, many things will become clear as it is. Like, I don't have to go separately make PDFs and PPTs about those documents. I will explain these things as we go through this document itself. So, application for Berufserlaubnis and approbation. Now, Berufserlaubnis is a temporary medical license, and approbation is a permanent medical license. That means you will send application for both right at the beginning itself, for Berufserlaubnis and for approbation. So, yeah, that where will you send it? How will you find it? That will be on the state. First, you will choose a state where you want to apply, and that state's website of licensing authority of that state. There you will go and you will find these things. These are not difficult to find. They're very easy to find. We have made a list of all the Behörde that are there. That is there in the course that I'm going to talk about later. But that is there, yeah. So, an original personalized university curriculum. Now, every university has its own curriculum. So this we have to ask them. It might happen that, okay, you think that, okay, how will I get this document? But if you ask a university, I need this curriculum, they have that. Now, the word personalized is important because the curriculum that the university has is a generalized curriculum. It is for all the candidates and not just for you. So what is to be done is that that curriculum has to be modified in a way that your name comes on top of the curriculum. That means then it becomes a personalized curriculum. That means there has to be a letter, a bona fide letter, which mentions that, okay, Dr. So-and-so has been a student of MBBS course in this university from this duration till this duration, and he has passed his course in this year and done his internship in this year. So when that mentions and that is stuck on the curriculum and it is pasted or like fixed so that it cannot be tampered with, then that is called a personalized curriculum. So these three things, the personalized CV, personally signed CV, application form for Berufserlaubnis and approbation, and the curriculum. These three things have to be sent in original. Now, further, attested copies. Attested copies, where can you get documents attested? If you Google nearby VFS global, then you will find the place where you can get documents attested. So you have to find in the internet when there will be a section of certification, not the visa. Like VFS is also responsible for visa documents collection, but you don't have to go for visa section, but for certification section. In certification area, you will find out that they give you appointments. Many offices gives appointment. Many have walk-ins as well that you can go there. It costs money. They charge fee. Now that fee depends upon country to country. You have to find out, and it also changes with time. So you have to find out before you go for attestation that how much is the fee. What documents are to be attested? The birth certificate, passport, MBBS or BDS transcript, MBBS or BDS degree, internship completion, FMG examination result for foreign medical graduates, those who have studied in a country different their home country, and medical council registration of training country or country of origin, and work experience certificate if available. Good standing certificate from country's national body, not older than 3 months, and police clearance certificate, not older than 3 months. Now, these 10 documents have to be collected, it has to be attested, and then these 10 documents, along with those three documents that you have seen before, along with these three, it has to be sent to the licensing authority per post. That will be your first step towards license. Now, the question comes, when should we do this? Do you guys have any idea when? What do you think? We have 13 people active at present. When do you think is the right way to do that? Write in the comments fast, please. Anyone? When should you send an application? Okay, we'll not wait too long. You are free to keep on like writing in the chat. But in my view, you have to apply when you're about to finish B2. No, answer during B1 is right answer. After B2 completion, it will be little late. So Nikita, you have to try to apply before completion of B2. During B1 is the most appropriate answer, I would say. Uh, After B1, before B2, correct. Yeah. So before B2, correct. Yeah. So most people who are watching this have like a pretty good idea when to send the application. The application has to be sent before your B2 completion. What has to be imagined or what has to be thought is that when are you tentatively going to complete B2? Because you have to send 3-4 months before that. So that by the time they process your documents and the deficit Bescheid comes, you are already done with your B2 or almost done with your B2, and then you can focus on the Fachsprachprüfung course in Germany, and you can apply for visa. So for visa, you have Fachsprachprüfung admission, you have this deficit Bescheid, and if you're fortunate, then Hospitation confirmation. So then you can go for visa application or visa interview. So that's why these documents have to be sent at around B1 level. Okay. Now, going further, languages, that everybody is clear that B2 is mandatory. One has to finish till B2. Some states are not asking for B2 certificate. Okay. But that does not mean that you don't have to do B2, because if you don't do B2, then in Fachsprachprüfung admission, you will have problems, because the institutes here, they will not take you in the Fachsprachprüfung course. That's why B2 doing is important, even though if the Bundesland is not asking for B2 certificate. All right. Okay. Now I will take in between. I will take these questions when I have gaps so that we can like minimize that waste of time. So someone asks, I have studied A2 in fourth year MBBS. I've completed B2 in my final year. How can we send application without other documents? Yes, you cannot send documents without other application. So That's why I first went through the list of documents that these documents are required. So if you don't have internship completion, for example, and if you don't have license, for example, then you cannot send documents. You'll have to wait till you have those documents. If there was only one document missing, for example, if a degree is missing or license is missing, one or two document is missing, then fine, you can send rest of it, and the remaining you can send later when you have them. But if you are in a medical college and still not finished, then you cannot apply. Yeah. So yes, Nikita, you'll have to finish that first, and then only you can apply. Yeah. So orientation, this we don't need to talk about. Important learning language we talked about. Attestation and translation we talked about. Application for medical license we talked about. Then comes the topic of hospitation and training. So hospitation, as I said, that it is important to do hospitation. However, it is not mandatory to do hospitation. How do you find hospitation? For hospitation, the process theoretically, if I say, it's very simple. You send emails to different hospitals in Germany, in different departments. Write to the head of the departments. Write a letter where you show your interest upon how that you want to work there and you are interested in working in Germany. And by luck, like, I'm not saying every time by luck, because it is not very common nowadays that people are getting hospitation. I mean, our candidates, fortunately, they're getting hospitations, but I'm hearing from outside that people are finding it very difficult. People are not getting hospitations and all. And our candidates also, not all of them are getting. Like, there are a couple who have not gotten hospitation at all. But yeah, if somebody tells you that hospitation is totally dead and nobody's getting hospitation, that is wrong. It is not like that. Even last week, two of our candidates have gotten like acceptance for hospitation in geriatrics. So in Mayan. Okay. So hospitation, you have to write, prepare CV and send email. So when you get hospitation acceptance, you want to go to visa office so that you can get visa to come for hospitation. But that time you need to have deficit Bescheid and also a course for Fachsprachprüfung training, because that is what they will want. They will ask you to apply for like they will ask you to have a deficit Bescheid. Without that, they will not process your document, or they will not give you that proper visa that you want. They will give you another visa, maybe hospitation visa, on which you are not allowed to do part-time jobs. Okay, that is why it makes sense to get a visa which can be like useful, where you can do part-time jobs, collect money, and sustain yourself. This is about the application of visa. Which visa is the 16D, the recognition of professional qualification visa, is important. Nowadays, there is also opportunity card, but if you should go for opportunity card, that is still very unclear, because if you don't have these documents, if you don't have deficit Bescheid, if you don't have language completion, then you can go for that. And if you match those points of 4 point, then you can go for six. Sorry, I said 4 point, 6 points. Then you can go for that. But if you have these things, then I would prefer that you go through normal 16D visa, because the 16D visa is specific for you. The processing time would be lesser than an opportunity card, I believe. We don't have much experience with opportunity card as of yet. That's why saying anything for sure about opportunity card is little premature. Okay. So yeah, in the meantime, couple of questions. Can you please give overview of process for people who are already in Germany under dependent visa? Yes, Apurva. Then in your case, if you're already in Germany on dependent visa, then the first part of this conversation that I've started was that list of documents that you have to collect, and the CV you have to prepare, and the forms that you have to fill and send all of them to the place where you are located, to the medical council over there. Okay, so that is for you. It will be straightforward then. Yeah, you can ask the question. I'll take the question as and when the time permits me in between. Okay, so that it does not keep pending till the end, and it does not have to be 1 hour full. Like if we finish all the questions before that, it's a Sunday evening. Everybody can use their time better as well. Like, important thing was that we need to cover questions that people have, because it's been quite some months that I have done any webinar, and questions were piling up. Now we said visa application. Okay, so visa application, about the 16D visa, I also already said that you need your deficit Bescheid for that, hospitation acceptance for that, and FSP course enrollment for that. Now, these things are logistical things not to be discussed in this webinar about flight booking and all those things. Once you come to Germany, you will start doing the thing that for that you came. Like if you came for Fachsprachprüfung, then you will do Fachsprachprüfung course. If you came for hospitation, you will do hospitation, and then you will do city registration. If your visa allows, you will find part-time job. Now, part-time job with part-time job, you can earn up till around 1,000 to 1,100 euro monthly. That means if you get part-time job soon after coming to Germany, the money that you have in your blocked account stays there. I mean, stays there. You get that, but you don't spend it, so you can use it later. So that is a way that blocked account, because many people write about the financial difficulties that is there. So this process will cost money. Okay, so this process is not very cheap, because blocked account has to be there in the beginning. Now, how you can escape that entire 12,000 euro is that when you come for, say, 4 months Fachsprachprüfung course, then you pay only for 4 months blocked account money. That means it is 1,000, if 1,000 something for 1 month, then 4,000 euro. So, but that money you need to have. Okay, because we have to always think that what are we uh, like aiming for, because when you are working here, you will start earning brutto 5,500 euros monthly. Okay, so if you're aiming for something where you can earn 5,500 euros monthly, brutto at least, so netto becomes less, but brutto, then it will not come free of cost. You'll have to pay the things that is required. And also, it is logical that if you don't have money, then how will you sustain? It will take 6 months to 8 months time, or maybe 1 year time till you pass the exams and everything. So it has to be sustainable. So that money has to be arranged somehow. Okay, so that you can, I mean, if you take a loan from a bank or something, because that money is going to be paid back. That is, it's not like it's going to be totally go in vain. If you pass your exams, you are going to get a job, and you are going to, in few months time, be in the position to pay all of it back. Okay, but that has to be done. So that blocked account has to be this thing. That's why I said that focus has to be on the visa which allows part-time jobs. Because if you get a visa which does not allow part-time jobs, then you'll be here and you're not allowed to do any work. So you are using your blocked account money. Now, Fachsprachprüfung, as we all must be knowing by now, how many of you don't know about Fachsprachprüfung? If you don't know, just write no. So everyone knows about Fachsprachprüfung. All right, so it's exam for your temporary license. So let's skip ahead. About Kenntnisprüfung, KP. Is there someone who does not know about KP? If you don't know, just write no. FSP is exam for your temporary license. It is basically MBBS level medical German language exam. Focus is on German language. Usually is of 1 hour duration, 20 minutes, 3 sections. Doctor patient communication, documentation, and doctor communication, like as if you have to take the case and present the case. So that way you would be that is Fachsprachprüfung. Passing rate is around 50-60%. We have a course about that also on like a video course which I created a couple of years back. So many people, like a few hundred people, have benefited from that. You can also check that out. So, and KP is a Kenntnisprüfung. That is a equivalence exam that people whose medical license is not equivalent to that in Germany, they have to take that exam. It is a little deeper exam. It can be more than 1 hour long. It is a practical exam. There you have to examine a patient, write all the findings, and then have a, like, pattern is same as in FSP, but the level of the exam is little deeper. And then they not only go in that case, but they also go in theory of other departments, for example. Okay, so there this KP exam, FSP exam, that was the first one that you can take in as long as you want to, like till you pass. But this KP exam, that you can take maximum 3 times. If you fail the exam 3 times, then the doors of Germany for you as a doctor is closed. You cannot work as a doctor in Germany then. Okay, you cannot change your state and or anything. You cannot do anything. That is about these two exams. We have material in our course and everything, so you can check that out. About job search, how do you find a job? Now, job search is also again email sending, and then hoping that somebody will reply back to you. Then you go for interview, and in interview they ask you like basic questions, and they see a little bit about your medical knowledge, they see a little bit about your personality. Most important, how is your communication? So we have these mock interviews, and also we have in our sessions we will talk about that. So continuous job search is important. Nowadays you must have heard from other people that the jobs are getting less. Okay, that is correct, but don't worry about that, because it has been the continuous process. When I started searching for my job, that time also jobs were less in comparison to 3 years before. Okay, so jobs are less, but still, if you pass approbation, you will get jobs. Okay, and for people who are enrolled in our membership program in Dominance program, we have like guaranteed them that okay, we like for that is for the consulting program, but people who will enroll in our membership program, they will also be guaranteed that if you have approbation, then within few months time, 3 4 months time, you will definitely have a job. So you don't worry about the job, you worry about focusing on the exams and passing the exams. That is our like wish, that our candidates focus on the exams and don't worry about the jobs you will find, even though it's difficult. If you have good in, if you have passed the exam and your language is good and you're trained, you receive good mock training about how to pass the interviews and how to clear, how to create good impression during the interviews and hospitations, then definitely you will get the job. And then job search, once you get job search, job contract, then you get apply for residence permit and job permit, like work permit. Once you have that, then you get your insurance and everything, and you start working as a resident doctor, but that is not PG. Till your approbation, work that you do is not PG. It is your work, your job. You will be getting a salary and everything, but it will be not counted in your PG. To count in PG, you need to have approbation. From that day onwards, it counts as PG. Okay, so our guidance is still approbation, because we want our candidates to start PG. You're not, the focus is not just getting into high paying job in Germany, but to complete the post graduation, to enter the post graduation. That is the aim and the zeal of our company, and that is why we support candidates till the approbation. Okay, now we will take a couple of questions. If you have more questions regarding this, then now a question is about a Georgian graduate eligible for PG residency without internship from India. No, no. This I have said in my video which I made last night, that for Georgia we have had one case of failure. Okay, we have taken that candidate and ultimately did not work out. So we then we stopped taking candidates for Georgia, because they ask for your licensing exam in Georgia, your medical license from Georgia. The next question is that what other options if hospitation is not available? Can you prepare for FSP? Can FSP and hospitation be done together? Now, you can definitely prepare for FSP without doing hospitation. For that, there are FSP courses, there are classes, online and offline classes. So that way you can prepare for that. Can both be done simultaneously? You cannot do both simultaneously, like, because like, I'm talking about offline classes, because you need time. You need to go to the classes for offline classes. So if full day you are in hospitation in your hospital, how will you go for the offline classes? You can do that online. You can go do your hospitation 5 days a week, and on weekends maybe do online classes. That is doable. So, but offline classes with hospitation is not practical. So next question is, I belong to can't afford blocked account, but I want to pursue this pathway and I've done till A2. Now, for somebody who cannot afford like 10,000 euro for blocked account and have done till A2, question is that any scholarship pathway like that by which you can get stipend for monthly basis. See, scholarships as such is not there. As far as, I mean, he must be having some idea. I don't know, but if you ask me, I would say I don't know about any such scholarships. What one can do first is get blocked account on loan, bank loan or something, and then come here, do part time. That is what many of our candidates in our consulting do. That is what we tell them, that okay, if they can find a like loan from family, friends, or bank, then and then they come here, do part time jobs, save the money, and within 6 months time, when they start earning, then they repay everything back. That is one way to go. But that is a very simple, like direct way. Other thing is that to do another Ausbildung. The Ausbildung is internship, like basically apprenticeship, so training, basically as a maybe nursing professional, or a MFAs, medizinisch Fachangestellte it is called. So some Ausbildung where you will be paid 1,000 euro right from the beginning. So you're doing training in Germany. All trainees are also paid. So not only for medical PG but other trainees also. So if somebody is becoming carpenter, so he's been paid for his 3 years of training for becoming a carpenter. Okay, so he's paid 1,000 euro monthly, approximately. I don't know exactly for carpenters, but for MFRs and all, it is around 1,000 to 1,200 euros. So that way, and this job you can get from your local place as well, like from your country as well. So then, if you have a job contract, then you don't need any scholarship. I mean, don't need any blocked account, because it is another way is FSJ, it is called Freiwillige Sozialjahr, means freiwillig social work. So that also, through that also, you can go to one of the like basically in department like fire department, or in some Altenheim, that's old age home. So there you can go, and there you can do your 1 year of training of Freiwilliges Sozialjahr, and there also you will be paid. So these are the ways you can get Ausbildung. So Ausbildung, okay, 1 year this FSJ is not Ausbildung. That is, you can do it like that. You can apply, and once you come with that, during that 1 year, you can earn money. You can apply for license, and by that time the 1 year is finished, you can take Fachsprachprüfung and start working as a doctor. So those ways are there. Okay. Now, next question is that what are the subjects to be covered in KP? Subjects to be covered mostly are innere medicine, chirurgy, orthopedics and trauma, Notfall medicine, pharmacology and medicine, a little bit. Microbiology can also be asked. So all of them little bit, but most important, orthopedics, trauma, general surgery, internal medicine. In internal medicine, cardiology, gastroenterology, and all of that. We'll take these questions. But before that, let me introduce you to one of the thing that we have started now. Since you all know that we have to 20,000, approximately 20,000 people in our YouTube, and a few hundred, like 300-400 people in our online courses. So far there are few, like, people every year. We take 12 candidates in our premium consulting program, which is more personalized individual guidance directly from me via WhatsApp or maybe regular Zoom calls and all. So there is a gap between premium candidates there where I'm personally involved, and I spend lots of time with those candidates, and then the roadmap courses which we have, where the courses once made and are not there's no personal support from my side. So now we have decided to come a little bit midway also, because there is a huge demand from candidates. Every webinar or every session that I do, especially people from Southeast Asia, from Africa, they say that why don't you come something in between, like so that your guidance is also there and it's also not very expensive. Okay, so for that, then we came into this thing of community. That means in community, the courses that we already have, they will be updated. At present, for few months, the same courses will be there. The courses will be there. You will have access to those courses. Plus, there will be a community where the members can talk and discuss things about themselves, and I will also be there in the community. So I will be also actively sharing my ideas and inputs in that, and and we will also provide lots of materials about the exam preparation, the protocols of the exams, and all those things, about licensing help. Now, see, this is our academy, which at present has 2 courses. We have we had more courses, but we have cancelled them because of some reasons. But two basic courses. This roadmap course, which was initially created in 2020 and has been regularly updated every year. Now things keep changing every 3 months, 4 months. Now it's not possible to update these courses so often. So I update it at least once a year. Okay. and it costs 139 euro. And then we have Fachsprachprüfung course. There, this costs 349 euros. So we can also see the content. I hope it works. So Fachsprachprüfung course. So you can see here, the exam pattern is explained. And these courses are from
One
English to
earns
German.
more
I'm
than
just going.
this. Only male nurse. Altenpfleger, that is a geriatric male nurse. And Pflegedienst is a caregiver. About Pflegedienst concept.
So these are the way one can enroll. Now, what we have decided is that we will give access to these two courses, okay, and more material will be coming, and plus there will be a community where all of us can meet and talk and do live sessions, to webinars. Online video courses will be available, and peer-to-peer guidance, regular webinars will be available. There will be network building, and that will be moderated by me. So this is the new plan that we are going to do. I'm a third year medical student from India learning German side by side. Could you please suggest me what would be better considering moving to Germany, moving right after MBBS or after MS? If you have decided to move, then after MBBS. Why would you wait and struggle to get into MS and after that you come? So because the journey will be same, you'll have to repeat lots of things. So rather come during or after MBBS itself. Next is I'm concerned about that there is no structured training in Germany. That is true. That should be a matter of concern. There is no structured training in Germany. Training is as per your own initiative. If you are hardworking, if you are interested, then you will learn. If you say that okay, I'm getting my monthly salary, rest is irrelevant. It's okay. I'm cool with it. Then you will not learn too much. So that is a problem. Are German board certified? Yes, yes, that is the thing. That German board certified surgeons are recognized in UAE and Saudi Arabia and all the Middle East countries. In fact, highly paid also, because here I will tell you that the training of 5 years, 6 years, they don't directly go after that. After that also they do 2, 3 years, 4 years work in Germany. So during training, it's not very structured. You don't learn much, but immediately after training for 2 years, you're on your own because now you have the title. You can do things on your own. You are allowed to, or you're supposed to do things on your own, and then you learn. Okay, so the German board certified are highly regarded everywhere. I think that's the reason. Not directly after FACATS, but maybe 3, 4 years after that. Next question is, I understand there is no age criteria, but would a gap in clinical practice be considered negative when we got job interview online application? If there is a gap in clinical practice, you will have to explain why there is gap. Okay, so but otherwise, if you can explain it properly, then there is no reason to worry. Is it allowed that we can go to Germany by Ausbildung pathway and there we give our exams during Ausbildung? Yes, yes, definitely you can do that. Possibility of getting into specialties like neurosurgery. Yes, possibility is there, but difficult. There are many international doctors working in neurosurgery, but it's difficult. Okay, so you need to have that CV, you need to have that language, you need to have, because it's simple. More competition, so difficult chances. If you are that person who can manage and be up above that competition, then fine, you will get it. Cities or tier 2, 3 town is better for IMG getting specialty liking. Tier 2 and 3 towns would be better to start with. Later on, you can move to bigger cities, but initially it would be better to go to the smaller places. The next question was, when should you take the courses that I have just tried to advertise you guys? The sales does not come naturally to me. So that's why it's also not very sleek that many salespeople do. But I have to tell you. Otherwise, if I don't tell you, then who will tell you and how will you know that this is something that can be beneficial to you? So that's why. So when do you take it? When you start researching and trying to know more about Germany. That is the time, because there you will get more and more information. If you are a second year medical student, then you don't need it because it's a monthly subscription. That means you're paying monthly. But once you have decided, okay, now I'm starting learning German, you can have groups of people who are learning German, and you can then communicate with each other, test each other, like communicate, like do talking practices together. So with common purpose, common zeal of doing medical PG in Germany. So that way it can help right in the beginning. When you start preparing your documents, then which document is required, what where do I get these documents, all these samples will be in the course. Like I have these samples, I have a Dropbox for resources for integrated program that I use for candidates in our integrated program. So which I have like collected over the period of years, and now I share that with them, and then we create new, like we don't copy paste, but that is for reference. So if you somebody has seen, for example, 20 motivational letters, so writing a motivational letter by themselves becomes very easy because they have seen 20 motivational letters which have been successful. Okay, so same with CV, that okay, you know how a CV is to be prepared. Same with the communication with the licensing authorities, that okay, we get so many replies and everything for so many candidates, so we see that okay, this document is sent, they replied this way. If we have to communicate with them, how do we communicate with that? So all those things, so those resources will be made available to you in that course. Okay, so that way once you have everything, once you applied for everything, then also you'll need it. But then you have missed lots of it. You have the mistakes that you have done are already done. Okay, so I would say after once you started preparing for documents and everything, started learning German, you can enroll with that. That way you will be staying in touch. I will try to do like a session, live session every 2 weeks over there. I cannot promise which date. Every 2 weeks will be 2 weeks, 3 weeks, maybe 10 days. So because of my schedule, as you guys know, we have hospital duties and not all weekends are free. So that's why I took this webinar at such short notice also, that okay, today I have free times, a couple of hours, let me do that. And so if you are in that group, you are in touch, you know about what is happening. um, I've done my post graduation in non-clinical branch. Somebody says you have done your post graduation non-clinical branch and there is age gap. You can do that. You can work in clinical branch. We have one candidate from Pakistan who is doing that, but you have to be careful that because of age barrier, since you write there's no age criteria required, I assume that you are a little bit on the higher side of the age. So do you really want to do that? Because working in Germany could be challenging. Learning everything from scratch could be challenging. You will be starting again from an intern position. So do you want to work at so like lower level and start from there? So that you have to think about. Okay, but possible it is possible. How can we German degree valid in India? See, I myself, after getting my German Facharts, I registered myself with the British Council, like the GMC, and I'm registered there as a doctor, as a orthopedic surgeon now. So when I decide to move back to India, or if I decide, maybe that will help me. But so far, nobody has done that. Now, one of my colleague has recently passed his Facharts, and he plans to go to India. And let's see how his process works. And I will update you in next webinar how it works. And then we will know better on from practical side. Theoretically, it is possible. Okay, practically how it works, that one has to do to find out. As I've completed my B1 and will be giving my B2 in few months, could you please guide me which course service should I be registered for from your website? Completed B1 and will be giving B2 in few months. Here, if you are interested in, because you're not yet applied, that is important, if you have applied or not applied, because lots of work has to be done before application. And so if you can afford it, then the premium consulting, the integrated program that is there, where you talk to me directly, and like you have WhatsApp and phone calls and everything. So and then I'm available. But if you are satisfied with, say, once in 2 weeks call, or once in one group session, basically it will not be personal call, it will be groups. So I will announce that okay, on this day I'm going to get online, and then everybody can get online and then ask the questions. That way it will be there. And if you have doubts, you can write a message as far as possible. I will try to answer that as soon as possible. So that if you can, if you want that kind of thing, then this membership is the best option. You can start, or at least you can start with this membership, see how it goes. And if you feel that okay, that is like you want more of the services, then you can move further, you can upgrade. Use our visa application at immigration department in Germany, then what can we do? Already postponed FSP once, now deadline. Vivash, I mean, I know your name. We have not met, but you are regular with us. Yeah, unfortunately, if your documents are lying in Germany, what you can do is that you can call them up regularly and ask them via email or phone calls. So that works. We have recently noticed that, okay, if you don't call them, things don't work at all. So call them up, ask them what is the process, what is the progress, and they will let. And about the deadline, you can write a letter to that authority who has sent you the deadline about the visa issues. Okay, so that deadline can be extended. So we have done that for many of our integrated program candidates. So that is possible. Time to consult with your company. See, I say that's better to do sooner rather than later, because I receive candidates who come to us so late that they already had some rejection, they already have visa rejection, they have like letter from the authorities that this document was wrong, that was wrong, delaying everything for months. And as I said, you have to think every month is your 5,500 euro that you are going to earn in Germany. So if you're wasting 3 months, you have already wasted 17,000 euros over there. So you have to think like that, that every wasted month is wasted 5,500 euros. Okay, so sooner will be better. Not applied, then wonderful, then you can contact us either for the integrated program or for this membership. This membership, I think, is for everyone. So if you have integrated program, then you'll be directly in touch, but membership, at least that will be at least able to ask your questions and get suggestions from me also, and from other members also who will join there, because everybody is at different level of their process. So people who have little ahead can guide. I mean, it's not 100% correct, because it's like blind leading the blind, because person who has only seen like one step ahead of him cannot tell the person behind him about the whole pathway. That is wrong. That is what happens in most of the Facebook groups and most of the WhatsApp groups. I get lots of people who share screenshots from WhatsApp groups. I'll not name those groups here. They share those WhatsApp. They say, oh, this person is saying this person is saying this, what should I do? I'm telling that you do what your gut tells you. If you feel that, okay, person who is 2 months ahead of you knows better, then you follow that. If you feel that no, Dominance International, we have been doing this for 7-8 years now, so we are the right people for that, then you listen to us. You do what you feel like. Okay. I'm from Pakistan. Visa process takes a lot of time. Can I get visa ASAP because I want to give? See, visa does not happen ASAP. Especially, we have had like candidates from Pakistan in our consulting, and the experiences are not very good about visa, because they ask for documents which are not there in the list. They ask for even though like some documents, they ask for like something else only, and then they are not ready to listen or explain, like get explained. So we've had bad experiences. Unfortunately, we cannot change anything about that. uh, ASAP does not work out. But yeah, I mean, everyone who applies, eventually process moves forward, so you'll have to have patience for that. Unfortunately, I cannot give you a positive answer on that. Next person has done pathology from India and age 40, good to start now. See, one can start anytime. Thing is that what is the motivation? If you're doing it for the future generation, that my kids will live in a developed country, then it's fine. But if you're doing it for yourself, that okay, I'm bored and fed up of the system that I'm working at present, and would rather go to different country, then for next 5 years you will have a very difficult time because of the language process and everything. So in 5 years time, again you will be settled, like stabilized. That is correct, but this 5 years patience for this 5 years is difficult to have. Okay, that's why you have to make your choice by yourself. If you are interested in guidance, then definitely we are there, but you have to make decision, has to be yours. I've heard that sponsorship visa comes much earlier, which means I should find some sponsor. You should find someone who will sponsor you. That is the thing. That obviously sponsorship visa is, but also tourist visa. So that Verpflichtungserklärung visa that a relative can sponsor. So otherwise, a job visa that you have to find. But what job you will get as a doctor? Because for doctor you need to have a license. Without license, you cannot get a job. Should we contact BFA Berlin or Munich, as I have applied in Munich? You apply. You contact Munich. You contact Munich where you have applied. What I wanted to again emphasize is that this membership program, that I also like did not think much of it because in last couple of years I was busy with my career itself. Like after my fakats, as I have mentioned that you are like more burdened because now you have to do things on your own and responsible and all. So now I have completed my 2 years of special orthopedics in joint replacement, and now I'll be starting with 2 years of my special trauma in one of the best like trauma hospitals in Germany. So I look forward to it, but I did not give much thought in the last couple of years on these things, that there can be a path in between where most candidates can benefit from like an affordable prices. If you guys yeah, just but don't wait too long, because maybe in 1 week or so the price will increase, because this is, I'm presenting it for the first time for you guys now. Then I will post it on YouTube, and maybe I'll write an email to subscribers, but this is first for you guys, so don't be surprised if the price increases. So if you do it sooner, it's better. During the German PG, can take along my family with me. During your PG, yes, you can take a family, because that is a job. That means you are getting a salary. So your family can visit you or come with you on a family reunion visa. So that is possible. I've done MS Ortho from PG at Chandigarh. Does I have to do Ortho again? Yes, unfortunately, you have to start Ortho again at least. So we have Ortho for 6 years in Germany. So your 3 years, even if they count like 2.5 years or 2 years from that, you still have to do like 3-4 years here. So that is unfortunately the case. Is there any benefit of doing specialization from India? No, as I have mentioned that I've to the previous question, that the duration that it's going to take. Obviously, you'll be more experienced and more like a finer surgeon. That is fine, but that does not reduce your duration. That does not give you more chances. You will have to do the same scut work that residents do, and same process you have to follow. So it's not better if you're doing your residency already in India. Then obviously it makes sense to complete it. You don't leave it halfway. You complete it. We had candidates who were doing residency. We guided them for 2 years. They decided in second year itself that they want to do in Germany. We guided them for 2 years, 3 years. After they completed the residency, the day that they got their like final exams results, they were already next week they were in Germany, and then they got Germany. They are working in good university hospitals in Germany at present. So if you are doing residency, then fine, you can continue that. But if you're not doing, and you think that I will do residency in India first and then move to Germany, then that is not a very good idea in my view. Is there what is the duration of internal medicine PG? Internal medicine in itself is a 5 years, but if you decide to do specialization, for example, cardiology, then you can do 3 years internal medicine, 3 years of cardiology. Same applies for gastroenterology also. Rheumatology is 5 years. Then there are also 5 years. Pulmonary medicines are 5 years. uh, the medical dental PG in Germany circle. We'll call it PG in Germany circle. That will be a circle where all interested candidates will be there, and information flow will not be from up to down. Obviously, it will be moderated, but it will be parallel as well, so that you get not only the information that comes from up, you get experiences also, and there that way you also enrich yourself, and not just during the pathway, but for later in your life when you are in Germany and working in Germany. That time also it will help you. All right, pediatrics, so 5 years. But don't ask me all these one things, because all of this is in the group. All of it will be in that group. The entire PDF of which department, how much time, how you should go about it, everything will be in the group. Come in that group, and then we can communicate all also like more regularly. All right, this was from my side. Thank you very much for your time. I hope I could answer most of your questions. I cannot answer the questions. There is no answer. What can I say? But yeah, I try to answer that, and I hope to see you guys in our PG circle, medical PG in Germany circle. All right, bye bye, and have a good time.